Hello again. I was reflecting today on how much, kind of culturally, we often have a hard time voicing our needs or advocating for ourselves when we're dealing with professionals. And it was interesting. I was chatting with someone last night who had reached out. She's from my province, and she had mentioned that, she was sorry to hear my experience about these guys, and she would be happy to pass along the name of the surgeon that she used because she was really happy with the results. What was really interesting is the surgeon she used is the same surgeon I had. Um, and I had an epiphany because what I realized is, I have a different body type than other people. We all have different body types. But, if I were thinner, having pronounced dog ears may not have been as much of an issue. However, I remember my surgeon suggesting that when she did the closure, she would pull forward as much skin as she could so that she would then sew it up. What I know now, though, is that body size, body shape doesn't make a difference with the closure. And really, what we should be looking for, striving for, advocating for is that our surgeons, rather than using one type of closure and saying, oh, sorry, I know doesn't give the results you want because of your body shape. Instead, our surgeons should have a variety of techniques so that when they are dealing with people with different shapes, sizes, whatever, they're able to adapt their technique so that they can give us the best final product that we deserve. And so, I know because I've seen now on other sites, and it seems to be more common in the States than in Canada, but lots of surgeons actually take the incision rather than going up. People will have their incision go right along back here and then closed even somewhere back here so that all of this is dealt with and removed, rather than having it end here. So again, I didn't ask more questions because I assumed that when my doctor was so knowledgeable and she did an amazing front closure, I just assumed that she would understand that part. What I didn't realize is I think that for her, she does one type of side closure. And if if it doesn't quite fit for some people, it doesn't quite fit, but again, she did an amazing job, and I feel like she's very committed to leaving the best possible outcome possible for her patients. But I wish that I, as a patient, had asked more questions, talked about my body shape, talked about her knowledge of closure, and then made some decisions based on that. So I would suggest to everybody take the time, ask the questions. I know in Ontario it's hard because, when you wait a year to just get in to see a surgeon, you don't really want to find out that that surgeon's not a fit for you and maybe have to wait another year. So there is that. But, getting the result that you dream of and deserve, maybe it's kind of worth asking. All right, take care.